This is Ed Sussman reporting for MedPage Today from the International Association for the Study of Lung Cancer's World Conference in San Francisco. Today we heard that an investigative drug used in the treatment of non-small cell lung cancer appears to hold promise that it can actually delay deterioration of symptoms caused by the disease progression. Dr. Roy Herbst of the University of Texas MD Anderson Cancer Center describes the results of the study.
Right, so vandetanib, which is a dual inhibitor of epidermal growth factor receptor and vascular endothelial growth factor receptor, used at a dose of 100 milligrams orally, which is lower than the single agent dose, actually combined quite well with docetaxel in a trial that met its primary endpoint. There was an improvement in time to progression, progression-free survival with a hazard ratio of 0.79, which was highly significant and met the primary objective of the trial. The thing that I think was even more compelling, however, was that when we looked at patients' time to worsening of their symptoms, we actually saw a significant benefit in favor of those patients who received the vandetanib. This was a symptom scale that asked patients 7 questions where they scored their symptoms 0 to 4, with 4 being the best and 0 the worst. And actually we looked for a deterioration of more than 3 points that was stable over 21 days. And if patients had that, we considered them to have worsening symptoms. And we saw that that time was delayed in those patients who received the new drug vandetanib versus those who received a placebo. So what this basically means is that not only did the tumors grow slower, which is always a good thing, but by growing slower, even though the patients were getting an extra drug, they reported in aggregate that they felt better for a longer period of time. So that speaks to quality of life and the whole issue that now we have an agent that can hopefully improve quality of life for patients with refractory lung cancer, where of course there are few good options.
Reporting from San Francisco at IASLC, I'm Ed Sussman, MedPage Today.